Okay, I'm gonna go ahead and check the physician's orders. I see that I have a wound care dressing. Gonna go ahead and get all of my supplies. Knock on the door. Hello, how are you today? My name is Ria. I'm gonna be your student nurse. Let me go ahead and close the curtain and then perform hand hygiene. I'm gonna be doing a wound care dressing today. And then what I'm gonna go ahead and do is I'm gonna go ahead and ask for your name and your date of birth. All right, perfect. And then do you have any pain right now? Do you want any pain medication? No pain? All right, perfect. And then before we start, are you allergic to anything? No allergies? Okay, let me just go ahead and get some gloves on. It's getting stuck. Okay, we have our gloves on. And let me go ahead and get this ready. I'm just gonna expose you, all right? Okay, perfect. And let me just get this open. Okay. Perfect. Okay, so I'm gonna go ahead and assess your wound. I see that there's 8 sutures. I see that there is slight erythema and swelling. I see that the suture is approximated, but there's no odor and there's no discharge. So what I'm gonna go ahead and do is I'm gonna go and get my supplies ready and perform hand hygiene again. And then we can go ahead and start. Let me just move this up a little bit, okay? Perfect. And then I'm gonna go ahead and get them ready in the order that I'm gonna use them. Perfect, and then I have that. All right, let me just open them. Okay. All right, let me get everything open. And then let me just put on my sterile gloves. All right, my sterile gloves on, and then I gotta just ensure that I'm checking the view and just making sure that nothing gets cross-contaminated or anything. So I'm gonna go ahead and start cleaning your wound. We're gonna start with this. We're just gonna go in a zigzag motion all the way down. All right. And then I'm gonna go ahead with my non-dominant hand. I'm gonna just hold on to this, and I'm gonna clean away. Perfect. And then we're just gonna go ahead and apply this gauze onto your incision. And this is gonna go around your drain. Okay. And this is just gonna go on top. Okay, let me go ahead and put this down. Okay, and then let me go ahead and just put everything away. So that's gonna go in the garbage. I'm gonna remove my gloves. I'm gonna make sure that I'm gonna go ahead and label this with my initials, the date and the time it was done, just so that the next nurse knows. Let me go ahead and cover you up. And then is there anything that you're gonna need before I leave? Are you in any pain, any discomfort? Okay, perfect. And then I'm gonna go ahead and make sure that you have your call light. I'm gonna put the bed rail down. I'm gonna go ahead and put the rails up in case they do need to be up, and then the bed is low already. I'm gonna go ahead and leave. I'm gonna be leaving. I'm gonna chart outside. If you need anything, just go ahead and press the call light. I'm gonna open the curtain for privacy. I'm gonna go ahead and go into the computer, and I'm gonna document my assessment findings, and then make sure that I'm following or monitoring protocol of the facility, and then I should be done.